Hello, this is Kim Jong-il. We are going to cover the topic, the guidelines for premolar extraction. We diagnose in orthodontic treatment. We determine whether to extract teeth or not in the orthodontic diagnosis. In the extraction case, whether to extract posterior teeth, which means the third molar and second molar, or to extract unusually the lower incisors, upper incisors, or the first molar. However, many cases belong to the premolar extraction cases. In the premolar extraction case, depending on whether to extract the first premolar or the second premolar, there would be various treatment plans. To make it easier to understand, we are going to separate the cases into anterior crossbite, normal overjet, and class 2 malocclusion with large overjet. In the case of class 1, it is common to extract the first premolars of upper and lower, the lower second premolars of upper and lower. In the second premolar's extraction case, the posterior teeth should be moved more than the anterior teeth does. On the other hand, in the first premolar's extraction case, the anterior teeth should be moved more backwards than the posterior teeth does. If the patient has normal overjet with class 1, we have to first check if lower anterior crowding is severe or not. If there is severe lower anterior crowding, it is preferable to extract the first premolars of upper and lower. And then, what should we check in the case of slight anterior crowding? We should check if the lower incisors are lingually inclined or the upper incisors are lingually inclined. In other words, U1 to FH is normal at 114, but it is 105 before the treatment. This is the case of linguoversion. In this case, if the first premolar is extracted, it is likely to be more lingually inclined, so we have to consider IMPA as well. So, first check U1 to FH, IMPA, and IIA. And if IIA is around 130 degrees, the more retraction of the anterior teeth is not preferable. In this case, the posterior teeth extraction is preferable. For this patient, we can prevent U1 to FH from being worse by extracting upper and lower second premolars. IMPA changed from 94 into 88 degrees, and it didn't get worse. IIA changed from 128 to 138 degrees. We should check the labial inclination of the upper and lower incisors. And then check whether the POP is normal or steep. If POP is normal, it is preferable to extract the upper and lower first premolars, and if POP is steep, it is preferable to extract the upper first premolar and the lower second premolar, making steep POP flatten. What should we do in class 2 malocclusion? The common solution is extracting the upper premolar only, or the upper first premolar and the lower second premolar. First, if the overjet is large, we should check midline deviation. If there is no midline deviation, we should check there is the anterior crowding like class 1 malocclusion case. What should we do if there is slight crowding? It is preferable to extract the upper first premolar and the lower second premolar. If there is no crowding in the lower, it is preferable to extract the upper premolars only. In the only upper premolar extraction case, we should make the upper canine class 1 canine relationship and the upper molars full class 2. If the overjet is big, this patient already has full class 2. Both the upper and lower incisors should be moved backwards. The upper first premolar extraction is preferable to achieve this. However, if the overjet is not severe in the anterior teeth, the upper second premolar extraction is more preferable than the upper first premolar. By doing this, the molars move more forward and we can make the relationship full class 2. If there is midline deviation, we should check the following. If there is midline deviation, we should check if the upper canines are symmetric. If they are symmetric, the midline is centered. If the upper canine is symmetric, the upper bilateral premolar extraction would be made. So 3 premolar extraction with unilateral lower premolar extraction could be made. On the other hand, if the upper canines are asymmetric, the extraction should be made to keep the symmetry. In other words, asymmetric premolar extraction would be made. In this case, it is preferable to extract the first premolar in tooth number 10s, the second premolar in tooth number 20s, and the lower second premolar. The upper midline should be centered on facial midline. The upper canine should be extracted maintaining symmetric position. There are not many cases of class 3 malocclusion. We should first consider the upper and lower second premolars extraction. Like this, it is recommended that the molar is moved forward and the mandibular whole detention is uprighted. The anterior crossbite is the same. If there is a severe anterior crowding in the lower arch, the upper second premolar and the lower first premolar could be extracted. However, if the lower incisors are severely inclined lingually, you should be careful when performing the lower second premolar extraction. If there is no severe lower anterior crowding, it is important that whether there is severe upper anterior crowding or not. If there is severe upper anterior crowding, the upper first premolar extraction is easier. However, if there is no severe upper anterior crowding, the upper second premolar extraction is more preferable than the upper first premolar. It is because if the upper first premolar is extracted, the upper incisors would be placed posteriorly too much. Then, in the non-surgical treatment, it is likely for the lower incisors to be lingually inclined. In the premolar extraction cases, we can decide whether to extract the first premolar, the second premolar, or asymmetrically by referring to the guideline. We can decide extraction options by referring to whether the overjet is normal class 1, the overjet is large class 2, or the class 3 anterior crossbite. Thank you for watching.